Hi and welcome back to another video of Medic Notes. This video is on ectropion. For introduction, ectropion is a medical condition characterized by an outward turning or drooping of the lower eyelid, causing it to sag away from the eye's surface. This condition can affect one or both eyes, and may cause discomfort, irritation, and excessive tearing. Ectropion can also lead to exposure of the eye's inner surface, which is normally protected by the eyelid, making the eye vulnerable to dryness, redness, and other eye-related problems. The possible causes of ectropion include involutional changes due to aging process, facial nerve palsy, eyelid skin scarring, and bulky eyelid tumors. Ectropion almost always affects the lower eyelid. The main consequence is watering, since the normal collection of tears into the punctum is impaired. The exposed lid conjunctiva may become inflamed and keratinized. Corneal exposure may result from an extreme ectropion. Any ulceration requires urgent specialist referral. For management, involutional ectropion can be corrected by a simple surgical procedure. If the cause is a facial nerve palsy, then the likelihood of recovery of nerve function should be considered. If recovery is likely, frequent administration of lubricating ointment may be sufficient. But if the cornea is at risk, a temporary lateral tarsorrhaphy, in which the eyelids are sutured together, should be performed. Or botulinum toxin injected to induce a protective ptosis. Permanent facial nerve palsy and cicatricial ectropion are managed surgically. That's all for this video. Thank you.